Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me today for this emergency visit. Person came in with a loose tooth with some swelling on the lip side of the tooth. There you can see I had popped it before. He had a big pimple there. I popped it before I turned the camera on. But it's basically a fractured root. And there's the whole tooth with the tooth, the post, and then the infection space above it there. So most likely what caused this is a combination of the ginormous post and crown there that you could see. That's a really fat post for such a small root of the lateral incisor. But another reason, the post had been there for a number of years, but he got some decay around it that weakened it. So what was left of the tooth wasn't strong enough to support the post, and he probably bit into something, snapped it. Didn't notice it probably at first till an infection started, which is right up here, this dark area up in the jawbone. So now that he's here, he noticed it, put him on some antibiotics for a couple days before he could come in, and now we're going to take the tooth out. So as you can see, there's not a lot of room to try to get the tooth out. I'm using my straight luxator, and I just don't have any space for it, so I'm going to grab my ash forceps and just remove the top part of the tooth, basically the crown and the post, and we'll see what else comes up. Sometimes you get lucky and the whole tooth comes out, but in this case, no. There you can see the the post and what's left of the broken root there. Pretty messy. Let's vacuum that up with my surgical suction tip. You can even see where the root canal filling still is down in the root. So now I have a little bit more room to play in, and we know that there's no bone on the cheek side of the tooth because of that infection. So when I go to remove the tooth, I'm going to use my elevators, I'm going to use my luxator, and now I switched over to my favorite, the spade proximator. I'm going to use it on the roof of the mouth side and in between, and just try to wiggle it, get it moving. There you can see it's in what's left of the root's actually in pieces. There's a few sections there. So we'll try to, hopefully we can get the whole thing out. Sometimes you can only get out what you can get out, and you got to dig for it. But I always find with an area that's infected like this, it just makes it easier. The infections removed some of the bone, basically made the hole bigger, and now the tooth's going to want to move towards the lip to be removed. There you can see it coming, and it's pretty much out with the spade proximator. It's just attached by the gum on the lip side still. So got it out of the socket now, nice and loose. So next I'm just going to grab my ash forceps again, just to grab the root tip and remove the whole thing. And there it is. There, as you can see, I'm just going to check, make sure we got the entire root tip. And it's pretty ugly and gnarly and messy. And now I'm going to go back, vacuum out the socket, make sure there's no granulation tissue in there. I'm going to use my spoon excavator just to make sure it's nice and clean. So before I took the tooth out, I talked to the patient about if he wants to replace the tooth. Options usually are an implant or something removable. Patient's retired, 82 years old. He's leaning towards something removable, so we didn't bother to do any bone grafting to get ready for an implant. And then here's just a close-up of the crown and post, and then there's the bottom part of the root with some granulation tissue still attached to it. Let me just fit those together, and you can see how it's split quite a ways down, almost to the root tip. All right, thank you guys so much for watching. Hope you enjoyed this bloody video. Thanks.